Hi guys, this is Mikkel Archer. I decided to do my vascular case study on spontaneous aortic dissection. So this case presented with a 67-year-old female, came into the emergency room with some pretty severe abdominal pain, non-radiating. She was also experiencing some back pain, which occurred around the same time as the abdomen pain. Patient history: she's normal, healthy. No known health issues. For this case study, no lab values were obtainable. In our image findings, an abdominal ultrasound was completed, which showed her abdominal aorta with a bright echoic line within the lumen of her aorta. An aortic dissection is where the inner lining of the aorta tears. It's with the pressure of the blood pushing through the tear, it starts to dissect the aorta by separating the inner and middle linings of the aorta, causing a double barrel aorta that just kind of splits the aorta down. A spontaneous abdominal aortic dissection. They're very rare, but do occur. It occurs most often in elderly patients, sometimes with patients with hypertension, but it should be considered a possible diagnosis if they're having that non-specific abdominal pain. Depending on where the dissection is occurring, patients can have different symptoms. It can be abdomen pain, inguinal pain, pelvic pain, or even mimic other heart problems such as chest pain or difficulty breathing. Because there's so many different presenting symptoms, diagnosis can be very difficult, but early diagnosis can save the patient's life. It's a crucial thing to be able to catch it in time. There's been studies that have found that people who are more likely to get an abdominal aortic dissection are usually men in their 60s or 70s that have hypertension. One of the most common areas for these dissections to occur is infrarenal and often extend into the femoral or iliacs. Some dissections can be associated with aortic aneurysms, but not all are. Sometimes they're just totally random. The cause of an abdominal aortic dissection is unknown. They haven't been able to figure out why it happens. A lot of it's kind of related to age, atherosclerosis, blunt trauma, and hypertension is probably age and hypertension are probably the most common. Treatment for aortic dissections can vary depending on the severity, when it was diagnosed, and where the dissection occurs. So there's a couple different factors. If it occurs in the ascending aorta, it's treated with surgery most often. If it's in the descending aorta, it could be surgery or medications. An abdominal aortic dissection can be classified into two different groups. There's a type A and a type B. So type A is when the dissection in the aorta occurs in the ascending aorta, and type B is when it occurs in the descending aorta. Type A is more common and more dangerous because it occurs near the top of the aorta, where it exits the heart, and it can travel down into the abdomen. Type B occurs in the descending aorta, not quite as common, but still can occur, but it can still travel down into the abdomen just like type A can. If the dissection is found early enough and treated, the survival rate greatly increases. However, if the aortic dissection ruptures through the outer wall of the aorta, it will often be fatal. Less than half of the people with aortic rupture will survive. And that rupture just occurs when the outer lining, so it splits to the outside, and so you're just bleeding internally. If they do survive, lifelong follow-ups, medications, and monitoring of the aorta and blood pressure would be done just to make sure that nothing is changing as they continue. And for the patient in our case study, an MRI scan was done and confirmed that there was an infrarenal aortic dissection. This patient did not require surgery, but was put on medications and did follow-up ultrasounds. A year later, the patient remains stable and has no ischemic symptoms, so that's great. In her images documented, it shows that bright echoic line within the lumen of the aorta in trans, as well as in long. Color flow was put on the images and also shows that bright echoic line with color flow on both sides, so it's kind of depicting that intimal flap. The protocol for an abdominal aorta is to do the transverse images of the aorta for proximal, mid, and distal with both iliacs. After that, you measure the proximate and distal again in long, but also show it with color flow and Doppler. If an abdominal aortic dissection is suspected, you need to contact the radiologist and the ordering doctor to see what the next steps are. So differential diagnosis for an abdominal dissection is an acute aortic dissection, and depending on the history of the patient, it could also look like a retained piece of catheter. Ultrasound isn't the best way to diagnose an abdominal aortic dissection. However, it is faster than the alternative methods such as conventional MRI angiography, CT, or transesophageal echocardiogram. If patients are hemodynamically stable, then they can do the MRI angiography, but ultrasound is usually used because it is faster, and with it being so critical, that's important. Depending on where the dissection occurs, it can determine the treatment. It is a medical emergency and needs to be treated immediately with either surgical repair or medications and continuous follow-ups and monitoring of blood pressure. These are my 3 references. And then in the images, you can see that bright echoic line within the abdominal aorta. And then you can also see kind of the outer lining of the aorta with that echogenic reflector inside the lumen. This is a sagittal view where you can see that echoic line, and you can see part of the left lobe of the liver. So this is mid to distal abdominal aorta. And then this shows color flow with the echogenic line, kind of showing that flap, and color flow on both sides. And that's the end. Thanks, guys.